So we have a mission, vision, and values in human resources that aligns with the University of Washington as a whole. Oh, I skipped over my own slide here. Our mission is to do the best for the staff, the faculty to meet the larger mission, which is to innovate and improve lives with boundless opportunity to grow both personally and professionally. I want to give you this overview, which seems fairly basic, but it's a really good lay of the land in terms of where and who our 56,000 employees are. So as you can see at the top, and I'm not going to go through each of these in detail, but we've got 56,000 employees, about half of which are in one of 19 unions. We've got almost 11,000 academic personnel. And you can see here the population of graduate student employees, which is definitely relevant to all of you, and are about the same number of professional staff as academic personnel. And the reason I'm showing you all of these is because each of them has its own unique characteristics and employment rules and employment programs. And what human resources is doing at all times is pivoting to meet the needs of each of these populations where they are. And it's a busy time to do that. What you're going to hear more of today is what we do to support faculty. So these are the ways in which we support you with benefits, workday help, leave administration, disability accommodations, employee relations. Those three you'll be hearing a bit from Erin about in just a moment. Employee wellness, work life, and workplace giving. And we will wrap up there before we turn it over to benefits. So Cassandra will go into detail, but I wanted to share just a bit about how the benefits office supports you because it will be critical from now until you retire. So benefits is an area of HR that supports you through every chapter of your life here at the University of Washington, whether it's now in selecting your benefits and your retirement, your health insurance plan and administration. They administer the retirement plan. They manage your open enrollment process, your new employee orientations, and they do long-term disability insurance consults and administration. And they also do those when it comes to retirement, in addition to workshops. So a little bit about workday support before I turn it over to Erin. There are a number of ways in which UHR has a service team that supports you as self. So there are ways in which your department will interact with UW Human Resources and Workday, and there are ways in which you will interact with Workday yourself, whether that means putting in your own personal information, parts of your employee onboarding, your open enrollment right now, and then once a year. And that is where I am going to turn it over to Erin to talk with you about leaves, accommodations, and support for faculty.
Great. Thank you, Gwyneth. And so glad that you're here, everyone else. I'm glad you're here, Gwyneth, but welcome to the faculty. I'm so glad we got to be part of this orientation. My part is brief. I have been given a moment to talk about a couple of the services that my teams provide, leave, accommodation, and employee relations support. And you probably aren't thinking about these topics right now, and that is okay, because we will be here if and when you need us. So life happens. And if you need to take a leave for yourself or your family member for a medical or other protected reason, my team at HR Leaves on the screen there is here to walk you through all of these state and federal laws and university policies that add up to leave options for you. We keep your information confidential, and we help you take care of what you need to take care of. That is the same for accommodations for disability. And when I say disability, I mean any medical need that impacts your ability to do your job. It's a very broad definition. So if that is something that is relevant to you, HR Leaves will engage in an interactive process with you and with your department to work through a solution. On to my next team. At some point, you may find yourself wanting to, not a different slide, just a different team, the one in the purple box, thank you. And at some time, you might find yourself wanting to make a report about a concern. You're having a conflict, and I hope this isn't the case, but it's not unheard of that you would be having a conflict, and maybe that's with your chair or a colleague, or you want to know about your rights under the faculty code or see what's in your personnel file. Another team of mine, the human resources consultants, we call them HRCs, can help you with that. You can reach out to your HRC and they can guide you through processes to specific resources, whether that's them or another team, and answer questions about how things work. And again, these teams are the central UWHR teams, subject matter experts, not the folks in your department, who are wonderful and who will be supporting you with the daily operations of your department. But that is what I have for you today. Oh, one more little thing to add. If you are a manager of staff or student employees, for instance, and you're having a concern, some performance management you might need to do, or just not sure how you would treat an issue that's come up with those populations, you could contact your HRC to ask about how to do that in your role as a manager. For employee as self, all these other things are relevant. So thank you for a brief moment of your time today, and welcome again.
Thank you, Erin. It's me again. I want to share a last few things with you before I turn it over to Cassandra. One of them is the Whole You. The Whole You is a nationally renowned program, one of the first of its kind to holistically take care of the health and well-being of our our community at UW. Whether that be faculty, staff, students, community members, there is ways in which we are financially taking care of your health, nutritionally taking care of your health. I can share with you that it's 6:15 or 7:15 every Tuesday or Thursday. You can hop on and do strength training with the director of the Whole You. You can really think of it as a holistic wellness gym that belongs to you here at the University of Washington. So we will give you, as you have your onboarding process, we will give you information that you'll have. Much of that will contain information about the Whole You, work life, which I'll be sharing with you, and of course, your benefits. One of the things that's really important for the Whole You that they focus on is community and connection. So they do more than 1,000 events every year. That involves a faculty speaker series, which many of you, I hope, will participate in, whether it becomes topics about breast cancer awareness, nutrition, the importance of sleep, things that are really deeply fascinating that really fall into the areas of your specific fields of expertise. And UW Work Life. UW Work Life is the area of UW Human Resources that focuses on where your work life meets home and making sure that you have the tools you need so that you can come to work completely. That involves assistance with childcare. We have childcare centers on off campus. We have supports for adult and elder care, including education and support. They also are the relationship between the university and our employee assistance program, which is the Washington State Employee Assistance Program. I want to hover here for just a moment because it is an extraordinary program. It's the best EAP we've ever had. And I say that for several reasons. One example of which is that everyone in your home, everyone in what we would call your umbrella of care, is able to use the Employee Assistance Program. And an example of how they can use it is by calling because of an adolescent issue that your child is having that is about a relationship. And when they call with that issue, they would get 3 covered free therapy sessions with someone. And that is the case for every issue. So that in that same example, if instead of a relationship issue, it's later an issue regarding school, that is another 3 covered sessions. So there is a robust amount of support here for your family that we really encourage you to take part in. The Employee Assistance Program also includes manager and team supports. What that means is that if the department or your team, small or large, goes through an acute stress situation, perhaps there is a death of a colleague, or something else that is tremendously stressful that you're going through as a team, the EAP will physically come or virtually come, either way, and guide your team through that difficult process. UWHR also includes our Combined Fund Drive. And all of these programs, the Whole U Work Life and the UW Combined Fund Drive, is part of our team called the Employee Engagement Team. So you can see how these kind of wrap up holistically to care for ourselves and each other. So since 1984, $60 million has been raised by us, which is now you, to support local, national, and international nonprofits within our giving program. You will hear about this periodically. You will have folks in your department who are coordinators and ambassadors and hold events. This is a way to manage your pre-tax dollars. That season for UW Combined Fund Drive is actually coming up. So you will get emails that kick off that season. So as I wrap up, I just want to share, since there are about 100 of you on, that recently I launched what is called the UWHR Orientation to the Pacific Northwest. And I'm bringing this up because it is actually an orientation offered to all employees, faculty, staff, but that includes you. And I wanted to share that only because many of you are coming from other locations that are not the Pacific Northwest, whether that is another place within the US, whether that is internationally. And if that is the case and you are soon to relocate, please have your department HR person know so that they can reach out to me and I can add you to an upcoming session. They have been tremendously helpful for folks in just the few we've done so far. And then we put you in touch with each other so that you've got a community of new UW folks to chat with and commiserate with. And we go over things like childcare, transportation, housing, culture, you name it. It is about a 15-minute little talk I give, and then it's really a lot of discussion and Q&A from you. So I'm hoping that'll be really helpful if and when you relocate to the area. And with that, I think we're ready to pass it on to Cassandra. Hi.
Hello, good afternoon. Thank you very much for the introduction. Let me share my screen here and then we'll get started. Fantastic. Well, it's really great to be here with everyone today. My name is Cassandra, and I'm a benefits consultant here in the benefits office. So you and I and my colleague Wendy, who will be joining us today and who will present on the retirement portion of our benefits, we'll be going over a lot of information together. We will be available to help with questions in the chat. So as questions pop up for you, feel free to put those in the chat and we can be sure to address those as we go forth. Our very last slide today will include some information about how to contact us in the benefits office directly. So that's how you can get help from us over the phone, via Zoom, via email. We do have a full benefits team that is here to support you as you make your benefit elections. All right, so this orientation really is designed to be an introduction to your available benefits office. So along with reviewing some of the plan options, we'll also be highlighting some resources that are hopefully helpful to you as you consider your benefits for yourself and your family, and some resources that can help you with your enrollment within Workday. I'll be referencing the UW benefits website quite a bit because there is a lot of benefits available, benefits information available on there for you. You will find the plan brochures and those lengthy certificates of coverage. And you'll also importantly find the contact information for the plan administrators. That can be really helpful if you have particular services or procedures coming up. You can actually contact the plans directly, get information, and have those questions answered for you ahead of time before you even enroll. So step one is choosing your benefits. Step two is enrolling in those benefits within Workday. So Workday is going to be UW's benefits enrollment portal. The Employee Workday Help website, which you can see a little screen grab of here, right up here, is a really helpful website for you to bookmark. So I'll throw that in the chat here in just a little bit. But it's a great resource to utilize because it walks through how to make changes to your Workday profile if you need to update your address. It's where you can view your pay stubs, but it's also a gateway to the benefits website and the resources that I talk about today. Really important is the deadline that you'll have to make your elections. So you will have 31 days from your start date to submit your health insurance enrollment elections within Workday. So you will all receive notices to your UW email address and to your Workday profile, letting you know that your benefit's eligible. And then in that email will be your enrollment deadline, along with some resources that can hopefully be helpful to you. So be on the lookout for those because the deadlines cannot be extended. Of course, please do reach out to us in the benefits office as well. We're happy to walk through those materials with you. Quick look at our agenda this afternoon so you can see the order in which we'll be reviewing these items. Up first, we are going to cover PEB healthcare and insurance. And then we are going to be talking about the pre-tax spending accounts that are offered here through the university and touch on two really important benefits, the life insurance benefit and the long-term disability benefit. And then I'll be turning things over to my colleague, Wendy, who will be looking towards the future for us, looking at the retirement plan options that you have available here. All right, so up first, as promised, we are going to be digging into PEB healthcare. And I just want to make a quick note here. There is a lot of acronyms that are used in the plan materials. So you'll see lots of acronyms used as you are reviewing the benefits materials. PEB stands for Public Employees Benefits Board. So that's the board that oversees benefits that are offered to UW and statewide Washington employees. All right, so PEB benefits do include vision, dental, life insurance, long-term disability, both employer paid and employee paid. And you might be wondering when your benefits are going to go into effect, which is an excellent question. And it does depend on when you start at the university. So when is your start date? So for instance, your insurance may start on the first of the month following your eligibility date. So the first example we have here is if someone starts at the university on February 10th, their benefits for themselves and any elected dependents will go into effect March 1st. Or it could actually be the case that your benefits become retroactive. So what that means is if you start work on the first working day of the month. So as the example we have here, if the first is a Sunday and your first day of work is Monday, then your coverage is actually going to be retroactive, effective back to the start of the month. All right, so really important, enrolling in your benefits. So we've divided up here medical and dental and vision separately because there are a couple different differences that we want to note. So up first for medical, you are able to enroll yourself and any eligible dependents during your 31-day enrollment window. You can choose to waive medical coverage. So medical coverage is not required for you to enroll in, but a note about that, if you do waive coverage for yourself, then you're just not able to enroll any dependents unless you experience a qualifying life event. That could open up a special enrollment for you during the year. That could be birth or marriage. The other opportunity that you'd have to make changes to your benefits would be the annual open enrollment period that happens each year. So each year you'll have an opportunity to change your benefits, your health insurance benefits specifically, for any reason at all. So open enrollment will be opening up before we know it here on October 27th. Next, vision and dental coverage. So vision and dental work a little bit differently because you are automatically going to be enrolled in dental and vision if you're eligible for PEB benefits. So you won't be able to waive those benefits. However, there's no cost to you for vision or dental coverage. So the university is going to pay 100% of the premium costs for you and your dependents. So you won't see any deduction for those. A quick note here just about dual state employees. Some of you may have a spouse, state registered domestic partner, or maybe you have a child working at another Washington state agency. You all can be enrolled in each other's medical plans as dependents. However, each individual that is a state employee will just need to be enrolled in dental and vision with their own entity. And then in terms of who is an eligible dependent, we have some information for you here on this slide. So eligible dependents could include your legal married spouse, in which case, if you were enrolling your spouse as a dependent in your coverage, there are some documents that you need to upload to verify that dependent. So you want to ensure that their coverage is active. For a spouse, that could be your marriage certificate and proof of common residence. Another eligible dependent would be your state registered domestic partner, just so long as both of you are unmarried and one of you is at least age 62. You can add them as a dependent within Workday and upload a completed declaration of tax status and a certificate of state registered domestic partnership to ensure their coverage is active. And of course, children can be included as a dependent on your plan up until age 26. So for children, examples of some documentation you could upload to verify them as your dependent would be a birth certificate or adoption paperwork. As you're going through and adding dependents within Workday, there will be some resources linked during the enrollment process where you can get some more information about the types of documents that will fulfill this requirement. But certainly if you have any questions at all, if you'd like us to take a look at the documentation that you have, please do reach out to us. We'd be happy to review that with you. We want to make sure that your dependents have active coverage as well. So part one, of course, is choosing a medical plan. So there are certainly some things to consider when selecting which plan is going to be the best for you and your family. We've highlighted a few items that we think might be helpful for you here. Of course, taking note of the provider network. So are your current providers in network? Maybe you have a doctor you really like, you want to keep seeing them. You can check to see if they are in network under the plan by either contacting your doctor's office directly, or there's a really handy provider search tool on the benefits website for each medical plan. You can actually look up your physician's name and it'll tell you if they are in network. And then plan availability, that's another critical one. Making sure that the plan is available where you live, but really important where your dependents live. So maybe you have a dependent that's living outside of your area, or maybe even in another state, making sure that the plan is available for them as well. And then, of course, comparing the plans and costs. So you can compare the premium, the deductible, the out-of-pocket limit. There is a really handy PEB plan comparison tool that we have linked here. It's on the benefits website as well. That's a really great tool to use. It lets you upload up to 3 plan options all at once, lines them up side by side, and then you can see just the differences between the plan options, compare what the premium costs are, what that annual deductible is. And of course, you can always contact the plans directly. If you have any services that you're receiving or any procedures coming up, you can contact the plans directly, get some more information from them as well. So the plan options do have some differences, of course, but what we're going to look at first is what is going to be true of all plans. So regardless of which medical plan you choose, None of the medical plans have a pre-existing condition exclusion. There's also no lifetime maximum. And then preventative care is going to be covered 100%, just so long as you see an in-network provider. And then prescription drug coverage, really important. That's part of each medical plan. So that coverage will be included in your chosen plan. All right, so the big reveal, there are 11 plan options to choose from. So what we've done with these 11 plan options is we have divided them into 3 different design categories. So I'm going to talk a little bit about each design category here. The first one is the Consumer Directed Health Plan. So these are the CDHPs. There are 3 high deductible plans in this group. So these plans are similar in nature. They'll all have a higher deductible than the other plan options. And with that, they'll also have a higher out-of-pocket limit. But the trade-off is that they have a lower monthly premium cost associated. And enrolling in a consumer-directed health plan does also come with automatic enrollment in a health savings account, which the university actually makes contributions to on your behalf, which is pretty nice. All right, the next set of plans, that's going to be your managed care plans. So these are 4 Kaiser plans. So if you select one of these plan options, you would be required to designate a primary care physician within the Kaiser network who would be coordinating your care. So for any specialty care that you are seeking, you would just need to get a referral from your primary care physician to coordinate that for you. And with these plans, do just make sure that you check the network because these plans are specific to the Pacific Northwest. So if you have dependents that are living outside the state that may have Kaisers near them, they may not be in the Kaiser network. So just double check that if you are considering this plan, one of these plans, and you have dependents living outside of the PNW. And then the last group, these are the preferred provider organizations. So these are the PPOs. So these plan types will generally allow you to self-refer to any provider in most cases, granted that they are in network. So you won't need to designate a primary care physician for any specialty care. You could self-refer to a specialist in that case. There is one important item that I do want to be sure to note though, because 2 of these plans, these are going to be the 2 plans at the bottom, the UMP Plus Puget Sound High Value Network Plan and the UMP Plus UW Medicine Accountable Network Plan. These will actually be retiring at the end of this year, so they won't be available for 2026. So if you select one of these plans just this year, just note that you will have that coverage through the end of this year, but you may want to select a new plan during open enrollment, which will happen October 27th, and it will run through into November. Otherwise, if you don't select a new plan during that time and you've selected one of the plus plans, then you will just automatically be moved into the UMP Classic plan. So just a note there about an upcoming change for 2026. So all of the plans are subject to 2 additional surcharges that may or may not apply to you. And I just want to run through those with everyone. You will complete questionnaires during your benefits enrollment, and how you respond to the questions will determine whether or not these surcharges apply to you. So the tobacco surcharge would be applicable to you if you or any of your enrolled dependents is a recent tobacco user. The second surcharge, which is the spousal state registered domestic partner surcharge, that is only going to apply to you if you are enrolling your partner in coverage when they have access to a plan similar to the UMP Classic plan through their employer. Now, if you're not quite sure if that's the case for you, as you are making your elections within Workday, there will be an enrollment questionnaire linked there, so that can help identify if that's you or not. But certainly, if you have any questions or you want to talk to one of us about that, feel free to reach out to us in the benefits office. We can help clarify that for you. All right, Moving on to dental coverage here. So as a reminder, UW is going to pay 100% of the premium cost for you and any dependents that you enroll in dental. So there's no payroll deduction for dental coverage, but you're not able to waive coverage for yourself. There are 3 plan options to choose from. So that's going to be the Uniform Dental Plan, which is a preferred provider organization. So that's a PPO. So with that plan, you'll be able to self-refer yourself to any dentist. But just note that in-network providers are going to be less costly. The Willamette and the Delta Care plans operate a little bit different. These are going to be managed care plans. So if you select one of these plans, you will be asked to designate a primary physician who would coordinate your care. So for more information about the dental plans specifically, I do recommend checking out the dental page on the UW benefits website. There is a very lengthy chart that provides some helpful information as you're comparing these plan options. So that chart can help you determine what the cost of a filling might be or a crown might be, depending on which plan you select. And then vision coverage is going to operate very similar to dental because there's not going to be a cost to you for vision coverage, but you're not able to opt out. So you'll be automatically enrolled in that coverage. A couple of things to note here as you are deciding which plan option might be best for you. Of course, if you have an optometrist you'd like to keep seeing, check to see if they are in network under one of the plan options. But there are 3 options to choose from. It's going to be the MetLife Vision option, the iMed option, and then the Davis Vision by MetLife. There is a much longer chart for vision coverage as well on the benefits website you can check out, and that can help you determine what the costs might be for different services depending on your needs. One thing I do want to highlight for everyone though is you see on the left-hand side of the slide here, it says every odd year. So what that means is your allowance for frames and lenses is going to refresh every odd year. So that doesn't mean that you need to necessarily use your allowance only in an odd or even year, but just know every odd year it'll refresh and you'll get a new allowance. All right, and then the switching gears here just a little bit, we are going to talk about some of the pre-tax spending programs that you'll have access to. So that is going to be the medical flexible spending account, the limited purpose flexible spending account that's going to be available to you for vision and dental expenses specifically. And then we will have a health savings account available for those that enroll in one of the consumer-directed health plans, as well as a really great dependent care assistance program that can be available to you for help savings towards child or adult dependents. So generally, these programs are going to allow you to save money by letting you deduct tax-free contributions from your pay, which are then deposited into a spending account. And then you can use the dollars in your spending account to pay for qualified medical expenses for you and your dependents. And as long as you use those dollars for qualified expenses, those dollars are never taxed. So because of the tax advantages of these accounts, they are regulated by the IRS. So there are contribution limits that you need to keep in mind. And the IRS also doesn't allow you to stack some of these programs on top of each other. So we've highlighted a few of those here. You're not able to enroll in a medical FSA if you are going to be planning to enroll in a limited purpose FSA as well. So you'd have to pick one or the other there. And then you're also not able to enroll in a medical FSA if you're going to be enrolled in one of the consumer-directed health plans. And that's just because you would have a health savings account set up for you that you would have access to. Everyone, however, is able to enroll in the Dependent Care Assistance Program, so no restrictions there on stacking that program on top of any others. Another really important benefit available to you is going to be the life insurance benefit. And so the university is going to provide at no cost to you $35,000 of basic life insurance and $5,000 of AD&D insurance. Now, beyond that basic coverage, there is also optional coverage that you can choose to purchase for yourself and your dependents. So you can purchase individual life insurance coverage anywhere between $10,000 to $1 million in coverage in increments of 10,000. So a key detail of enrolling in this optional life insurance that I want to be sure to share with everyone is that this is the one benefits enrollment that takes place outside of workday. So in order to purchase the optional life insurance coverage, you would need to travel to the benefits website. We, on the benefits website, will have the MetLife enrollment form. So MetLife is the plan administrator for the life insurance benefit. So you could complete that enrollment form, elect your optional coverage, and then submit that directly to MetLife for processing. Really important, that enrollment form also has beneficiary designations. So even if you are not planning on purchasing the optional coverage, it's a good idea to grab that form, process your beneficiaries directly with MetLife. Once your coverage is effective, you could also log on to the MetLife website and designate your beneficiaries there or change your coverage option. Now you can add or reduce the optional coverage at any time you'd like, but just know after your first 31 days of eligibility, that's when MetLife would request an additional statement of health from you if you choose to enroll outside of that window. So the long-term disability benefit is another really important benefit that's offered to you here. There is an employer-paid and an employee-paid option. So the employer-paid option, well, that's going to be set up for you automatically. So you will automatically be enrolled in that. But these options can replace a portion of your income if you are unable to work. Now, in addition to that employer-paid option, if you'd like to provide additional coverage for yourself, or if you have folks that are dependent on your income, you can choose to enroll in the employee-paid option as well. So you can elect to have 60% or 50% of your pre-disability earnings paid out to you if you are unable to work after a 90-day waiting period. The employee paid option is not required, so you do have the option to opt out of that if you'd like. An important feature of the long-term disability benefit, since there's that 90-day waiting period, this benefit does work in tandem with other benefits that are offered through the university and through the state. So if you have any questions about shorter term leave options that are available to you, please do reach out to your chair or your department, the HR Leave Management Office. They can assist with some of those options. And then a quick note here about the Washington TERS Fund. This is a mandated long-term support services program that does require employee payroll deductions at a rate that is set by the state of Washington. So you'll see those deductions on your paycheck. Really important, if you have an approved exemption from the Washington CARES Fund, just be sure to let the university know that. So you can either submit that letter directly to your payroll department or on the Employee Workday Help website. There is actually a spot where you can just upload this form and it'll send it directly to the payroll department from there as well. All right, so at this time, I am going to go ahead and turn things over to my colleague, Wendy, who is going to walk us through the retirement options. Thank you all.
Thank you, everyone. I'm going to go ahead and share my screen. If I didn't get to all the questions, Cassandra is actually going to take over the chat. So she's going to address your questions in the chat, and then we'll review it, of course, at the end just to make sure we didn't miss anyone's questions. So give me a second here, and I will go ahead and share my screen. Okay, can everyone see that okay? Hopefully so. Okay, so we'll go ahead and get started here. So this will just be kind of an overview of all the retirement benefits that are available to you here as a UW employee. Of course, there's going to be a lot of information. There's a lot more information available for you on our benefits web pages. You can definitely review all of these options there. Another great option I'll just touch on real quick is that you can reach out to Fidelity and to TIA for free financial advice on your choosing a retirement plan, on your retirement investments, any type of retirement questions, as they are licensed financial advisors. So they do in-person appointments on UW campus. They can also do Zoom meetings with you and also phone calls. So if you are interested in that, that information is available for you on the Whole U website and also on our benefits web pages. So if you have any more questions on that, though, feel free to ask us in the chat and we can provide that information for you also. So we'll go ahead and get started with the rest of the slides. Okay, so you're going to have a 30-day choice period for your retirement plan elections. So this does vary with the 31-day choice period that you have for your medical and dental, or your medical, dental, and vision benefit selections. So the retirement plans election is 30 days. So if you're going to be looking at both of those, just try to, I'd say try to make all of your benefit selections within that 30-day period. That way you won't miss either of those windows. So the choices here are going to be our UW retirement plan or UWRP. That is a 403B plan. We'll note that IRC code because that does have an impact if you also are participating in, if you're a clinical staff and you're also participating in the UW physicians retirement plans, or if you're also part of Children's Hospital retirement plans, please make note of that 403B designation there. Also, we'll talk about it in further slides, but our voluntary investment plan, the VIP, is also a 403B plan. So that does impact your contribution limits. So the IRS does have set contribution limits. If you do already have a financial advisor or a licensed tax professional, you can also definitely reach out to them for questions on that, on those contribution limits. But we do have a page also on our benefits webpage that you can look at for those as well. So the other selection here is going to be the Teachers Retirement System or TERS 3 plan. So that one is a 401A plan. So that has different contribution limits. And just a note here, if you did have prior retirement participation in a University of Washington plan or a state of Washington plan, that may impact the election choices for you. So if that is the case, the DRS will notify you. And also when you look in your Workday inbox, you'll see the plan choices available to you there. So also we send you emails into your UW email address. So again, if that does apply to you and you have any questions, feel free to reach out to us in the benefits office as well, and we can help walk you through that as well. So first up, we'll talk about the UW retirement plan or UWRP. So this one again has that 30-day election period. Important to note here, this will be the default selection that you'll be placed in if you do not make a plan election within those 30 days. So just important to note, if you want to make sure that you are able to have that choice that's correct for you and your family, just make sure to make those elections during that first 30 days. Another thing we need to note is those deadlines cannot be extended. So again, if you don't make your plan selections, you will be defaulted into other plans. So this is a 403B defined contribution plan. So basically how that works is, what you're going to be contributing and what UW contributes as a match, that will determine your retirement income. So that'll be based on your total plan savings. So this is a combination of tax deferred contributions and growth. Good thing about this plan is you will be immediately vested for all of your employee contributions and all of the UW's match contributions. So taking a look at retirement under the UW retirement plan, so it'd be age 62, regardless of service credit years, or you can do early retirement at age 55 if you have 10 or more years of continuous service. Important to note there, 10 or more years of continuous service means that you don't have a break in service of more than 30 days. So, if you do choose to leave the UW and then come back, and you have a gap of more than 30 days, then that 10 years would restart. So I want to make a note there. Also, you can look at our UWRP plan document online. That's available for you on our benefits website. Also, on our UW benefits website, we have a lot of additional details about the UW retirement plan. Kind of outlines, what that looks like, how to also contact again Fidelity and or TIA. Important to note here that we are going to be having a change of master record keepers for the UW retirement plan. So you may have heard about this from your colleagues, but for 2026, we will be transitioning over from Fidelity to TIA, and that will happen automatically. You don't need to make any kind of changes or take any actions. So we just want to make you aware of that because you might be hearing about that. We're going to be rolling out a lot more communications about that this fall. Also, TIA will be available. They'll be having a lot of in-person events. There'll be a lot of dedicated information so you can reach out directly to TIA about any questions that you may have. So, just look for more communications coming on that. So just wanted to make note of that. You'll be hearing about that. You'll be seeing that, but it will actually result in a lot of plan savings. The costs that you pay for maintaining your retirement plan, those will go down. So a lot of good things ahead about this change. So again, the election of the UWRP in the first 30 days starts your contributions. So currently, and this again is going to be only for 2024 or 2025. So you have optional participation for first 24 months, then mandatory. So that's going to be ending at the end of 2025. So you can have optional participation through the end of 2025, but starting on January 1st, 2026, those that participation in the UWRP, if you do make that plan election, that will become mandatory. So this is the default plan that you would be put into if you don't take any action to select a plan during that 30-day choice period. Again, another note here that's changing, where it says begin contributions anytime in the first 2 years, that's going to be changing. You can begin contributions anytime through the end of 2025, but starting on January 1st, 2026, you will need to make those mandatory contributions. As noted there, so once you're making those contributions, you can't stop. So again, as I noted, Fidelity currently is the master record keeper for the UW retirement plan. Starting in 2026, that's going to change over to TIA. So looking at your employee contributions and how your match will look. So under age 35, you will be contributing 5%, and then UW matches that 5%. Age 35 and over, you'll be contributing 7.5%. Again, UW matches 7.5%. Age 50 and over, so right now for the rest of 2025, currently, you would be contributing 7.5%, and you have an option to contribute an additional 2.5% to equal a 10% contribution, which is matched 10% by UW. So starting in 2026, if you're age 50 and over, that optional 10%, that will change to being mandatory 10% contribution. And again, that is fully matched 100% by UW. So, that's something, great for those folks who are, age 50 and over and starting at UW, that gives you a chance to put, more money away towards your retirement. So these investment options are selected by the UW. You've got a variety of choices from mutual funds, Vanguard target funds. Those have a target retirement date. Also, there's TIA annuities. And important to note here, there's a brokerage window available with Fidelity, and there will also be a brokerage window available with TIA. So whatever is, just important to note, whatever you're selecting now as your investments, once that plan transfers over, all your investments will transfer over as well. So, you don't have to worry about not having the same type of things available to you. Again, TIA will be available for any questions you have on that transfer, on those investment options. That there are a lot of helpful, great licensed financial advisors, and of course you can make free appointments with them. So definitely take advantage of that. So taking a look here at the TERS 3 plan, so this one is a 401A plan. So again, that's got a different IRC code, so different contribution limits. Again, important to note for those folks who are high income earners, and also for those folks who are clinical staff that are also receiving contributions to their salary, or separate salaries, I should say, from UW Physicians or Children's Hospital Group. So the TERS 3 is a hybrid plan, which is a combination of a defined benefit pension portion, and that part is paid for by UW contributions made for you. And then also there's a separate account that's the investment account. So that's a defined contribution investment account, and that's going to be comprised of your contributions. So important to note here, if you are a returning TERS 3 member, once you elected that TERS 3 plan, it is an irrevocable selection. If you have any questions on that, you can also definitely reach out to us at the benefits office. We can just check on your prior plan participation as well for you. So the DRS will also confirm to UW if you did have that prior plan participation. So again, if you did, the DRS will also notify you. Will notify you in Workday and also through your UW email. Also, again, to note there that IRC code, that 401A, both UW Physicians and Children's Hospital Group they also have 401A plans. So again, I've noted this, but just make sure to please manage your contributions, make sure that you stay within those IRS limits. If you have questions on those, please reach out to a licensed tax professional or also to a licensed financial advisor. We in the benefits office are not licensed tax advisors, nor are we licensed financial advisors. So we would definitely refer you to those more qualified folks for those questions. So taking a look a little bit more here about the two parts of the TERS 3 401A plan. So again, that defined benefit pension part, again, that's paid for by UW contributions. The vesting for that is 10 service credit years. There's exception if 5 service credit years, if 12 of those service credit months are earned after age 44. So that would allow you to kind of catch up and retire sooner. Those benefits are going to be determined by a formula for the pension part. So that's going to be 1% times your service credit years times your average final compensation. So how that's determined, we call it the high five. It's your highest 60 consecutive months of pay totaled and then divided by 60. So that's how they come up with that formula. You can also view this formula if you'd like on the DRS website. And that DRS website is drs.wa.gov. Again, you can find links to this on our benefits web pages as well. So for that defined contribution portion, that's going to be paid for by your contributions that you make to the plan. Your contribution rate, we'll go over that on the next slide. Whatever you select is going to be irrevocable. So, just give that some thought before you make that selection as to what you feel comfortable with for the lifetime of your employment at UW, and also for, how long you think you might be here, that can help you determine what rate option might be the best one for you. So for your defined contribution portion, that vesting is going to be immediate. The benefits for that, those are determined by contributions and how your investments perform. So, that can be varied with the stock market, things like that. So just note that, again, that defined contribution, that's more of a variable investment performance there. So those investment options are going to be provided by the Washington State Investment Board. You can definitely also view those if you'd like on the drs.wa.gov site. You can look under the plans header at the top. And when you click on that, it'll show you the TERS 3 plan. And it'll go into a lot more detail about the TERS 3 plan. There's a lot of great videos. You can see that how the pension is estimated, a lot of great information on there for you. So taking a look here is the employee rate option. So again, you will select one of these options and this will be for the lifetime of your TERS 3 participation. So again, just make note of which one you feel most comfortable with contributing. Options B and C, you can see that those ones do go up with age. So, those can be a good option if you want to, start a little lower and then gradually increase, with age. So, again, just kind of give this some thought, think about which one might be the best choice for you and your family. So TERS 3 service credit. So this is taking a look at how service credit is determined. So you can see monthly, so full service credits are given for if you have 90 or greater hours of eligible compensation. A half service credit is for less than 90 hours, but more than 70 hours. So 1/4 service credit is given if you have fewer than 70 hours worked. So if you want to look at this information in a little more detail, it's also available on that drs.wa.gov site. So for the school year, so that runs September through August. So you would receive 12 service credit months. If you begin working in September and you work in 9 of 12 months through August, with 810 hours of compensated work. So then you would receive those 12 service credits. You would receive 6 service credit months if you begin working in September and you work at least 600, oops, let's go look on my computer here. At least 630 hours, but fewer than 810 hours. So again, if you have questions on that, you can definitely reach out to us in the benefits office, but a better resources would be contacting the Department of Retirement Systems, the DRS directly. You can check with them on how those are determined, any questions on that if you do have prior service credits. Also, members at UW will receive either monthly or school year service credits, whichever is higher. So again, any questions on this, a lot of information to take in here, just feel free to reach out to us in the benefits office. So next up, we've got 2 optional retirement savings plans. So the first one is the UW Voluntary Investment Program, or the VIP. Again, important to note here, that is a 403B plan. And again, our UW retirement plan is also a 403B plan. So important to note that again for maintaining, make sure you track your contributions and stay within those IRS contribution limits. The second choice here is the Washington State Deferred Compensation Plan, or DCP. So that one has a different IRC code. That one is 457B. So that's going to have different contribution limits. So both of these are unmatched. So these are ones that you invest in. It's your money, so you are 100% vested right off the bat in both of these plans. But just note that UW does not make contributions to these plans on your behalf. So a little bit more about the VIP. So again, those contributions are unmatched. The contributions can be made pre-tax with tax-deferred growth, or you also can do a Roth post-tax with potential tax-free growth. Important to note that 403B limit applies whether it's pre-tax or Roth. So for this plan, you can enroll, cancel, change your contributions at any time. You don't have to wait for annual open enrollment. It's got a $15 minimum contribution to start. You can do up to 75% of your pay maximum. Again, please note that you want to track those contribution limits. Especially if you're contributing to both the VIP and the UWRP, or if you're also participating in those UW physicians or children's medical group plans as well. So the VIP does allow qualified rollovers. So this is a plan that you can roll over your prior employer's retirement plan into. So this one does accept rollovers. Also with the VIP, you can do loans. There's hardship provisions and in-service provisions available for you as well. So next up, we're going to go over the Washington State Deferred Compensation Program, or DCP. This one is a 457B plan. So again, this has a different IRC code, different contribution limits. So you can contribute to both the VIP and the DCP if you would like. So this again is an optional unmatched retirement savings program. Again, the IRC deferral limit for 457B is separate than the 403B. And again, the 403B is for the UW retirement plan and the VIP. So again, you can use both plans in the same tax year. You can make those contributions pre-tax with tax deferred growth, or you can also do the Roth post-tax with potential tax-free growth. The eligibility is for all UW employees unless that exception does apply to you. These investment options are going to be provided through the Washington State Investment Board. You can also view all of this information on the DCP website. Also, you can go directly to that drs.wa.gov site, and you can actually go to the DCP directly from that site as well. So that kind of wraps up our retirement section. I know it's a lot of information. You probably have a lot of questions, but a good thing that is coming is that we have our benefits enrollment help Zoom sessions. So those are going to be available on the first and third weeks of the month. So that'll be on Wednesday, 5:30 to 6:30 p.m. and Friday, noon to 1 p.m. So again, that's on the first and third weeks of the month. Also, of course, you can contact UW Benefits for enrollment help. That's our main contact email address up there, benefits@uw.edu. Phone number 206-543-4444. These are all live links if you do want to click on those. Some folks just choose to Google us and find UW Benefits, takes you right to our page. Also important to note, just Workday is our HR payroll and benefits system. And for all of your enrollment, you're going to do that directly in Workday. So no paper forms are accepted. There's one exception for when you are enrolling in MetLife. So that's the only paper form that you use. And just, remember those deadlines, those can't be extended. So for your medical, dental, vision benefits, that's going to be that 31 days. For your retirement selections, that's 30 days. Also, this benefits orientation is going to be available for you online. So you can watch this again if you'd like. If you felt that you missed anything, you can rewatch it right there and kind of recap everything that we went over today. So just wanted to welcome you all to UW. We're happy to have you. And again, the benefits office is here to help you with your questions. We're glad to have you, and feel free to reach out at this contact information. Thank you all.